Hello, today is Monday, April 12th, 2021, and today I'm going to be talking about the new travel guidelines from the CDC. Well, folks, on Friday, there's good news that the Centers for Disease Control and Prevention, the CDC, said that those who are fully vaccinated against COVID-19 are no longer required to take a COVID test before or after traveling domestically or internationally from the United States, unless required to do so by the international destination. Now, just a reminder, to be fully vaccinated, you have to have completed the 2-dose series of the Pfizer or Moderna vaccine, and the 14 days have to have passed to allow your body to become fully immunized. Also, the Johnson & Johnson 1-dose vaccine, you have to be 14 days post-vaccination to be considered fully immunized. So there's good news that you don't have to get tested for COVID before traveling domestically or internationally, unless the country that you're going to requires that. Also, the CDC said that fully vaccinated people no longer have to self-quarantine when they get back to the United States, unless they're required to do that by a state or local jurisdiction. So that's good news for those of you who want to board airplanes, buses, trains, and travel. Now, I just want to have a word of caution to those who may be immunosuppressed. Those include people who are post-transplant, people who have a weakened immune system due to disease, illness, autoimmune disease, HIV, AIDS, or who may be on drugs that suppress the immune response, such as chronic steroids. Of course, always talk to your healthcare provider, but you may need to still be careful because your antibody response to the COVID vaccines may not be as strong as someone whose immune system is not suppressed, meaning that because your immune system's depressed, even though you're fully vaccinated, your antibody response may not be as strong. Now, as always, talk this over with your personal healthcare provider. I'm not suggesting that you not travel. I'm suggesting that you be cautious if you do travel, which all of us should be. If we have any high risk factors for COVID, be it hypertension, diabetes, obesity, heart disease, just because we're vaccinated fully doesn't mean that we should be taking unnecessary risk for COVID, such as not wearing our mask or frequenting high-risk exposure locations. And we should also be continuing to manage our high-risk conditions and getting regular medical care and taking all of our medications and our preventive tests. Folks, we still need to be concerned about these highly transmissible variants that are oftentimes traveler associated. And you may want to check out the status of the pandemic in the domestic location that you're planning to visit or the international country that you want to vacation in. And as always, even if you're not traveling, should you feel signs and symptoms of COVID, please do get tested for this virus and also see a physician. That's my message today. As always, my views are my own. Stay safe. But for those who have travel plans and who are fully vaccinated, the CDC has given you the green light to travel. Have a blessed day, folks.